Welcome and thanks for watching. The following remarks were delivered to OAO members at the 2016 Annual Symposium held in Toronto on April the 8th. We decided to put together this short clip so those who could not attend the meeting have the opportunity to receive this important information on all the latest things happening with OAO. This is a chance to see firsthand the true impact that your membership makes. Let's begin with insurance. As you know, running an optometry practice comes with the risk of certain liabilities. We continue to work closely with our broker, Hub International, to evolve our coverage and provide best-in-class professional liability insurance. To that end, there was no increase in premiums for existing limits and coverage this year. They remained at the 2014 level, even though we have significantly enhanced the offering. New this year, all policyholders now have an automatic $2 million in general liability coverage. We are also offering a special rate to new graduates, which provides the required $2 million PLI as laid out by the college at a discounted premium for $50 for the first year in practice. Currently, over 85% of members are enrolled in the PLI program. We strongly believe that you deserve the best possible coverage at the lowest possible rates, and we will continue to strengthen our offering to ensure that you receive just that. I'm also very excited to share with you that we have unveiled a new health spending account option to give more choice to practice owners wishing to provide health benefits to themselves and their employees. I encourage you to reach out to OAO if you have any questions regarding insurance and/or benefit offerings for yourself and/or your staff. Now, I'd like to move on from insurance to update you on our ongoing efforts to uphold the standards of eyewear dispensing in Ontario, specifically on the issue of internet dispensing. For obvious reasons, this is still an important area of focus. I can report that OAO did meet with Essilor International and Clearly multiple times in the past year. While these meetings did afford both sides the chance to share our differing perspectives, we remain at an impasse in regard to mandatory prescription verification. Until that obstacle is resolved, OAO stands by the following position taken by your board on January 11th, 2016. We will not partner, engage, or do business with any company or entity, including that company's parent company and its wholly owned subsidiaries, that sell prescription eyewear or contact lenses without the requirement of a valid prescription. This is something we take very seriously, and we have shared our position with all industry stakeholders. As always, we will update you on any developments. On a more positive note, we are moving forward with some extremely exciting initiatives. On the member services front, our mentor program, which we launched in the fall of 2015, has gained traction. Designed to help recent graduates learn and to empower them to grow in our profession, it offers confidential, peer-to-peer support by connecting recently graduated doctors of optometry with veteran practitioners. Speaking of the future, I'm pleased to share the latest on the OAO TPA app, and now have over 700 members using this app every day in their practices. Just recently, we launched version 2.0. You can now search by drug format, preservative-free availability, pediatric prescribing, and compatibility with pregnancy and nursing. You can now also search for over 130 drugs. OAO also owns the custom code associated with the app, which has now been licensed across Canada. This is a constantly evolving platform, and we are actively seeking ideas and feedback to help shape version 3.0. Moving on from member services, let's look at advocacy. First up, expanded scope of practice. Recently, the College of Optometrists of Ontario proposed an amendment to the Optometry Act, Designated Drugs and Standards of Practice Regulation, and Controlled Acts Regulation. The biggest proposed change would allow optometrists to prescribe any Health Canada approved medication within our scope of practice. If passed, this will improve both patient access and the patient experience, optimizing our role as optometrists. We are aligned with the college's proposal and will support it in every way possible. Also on the advocacy front, we've joined a collaborative pilot project with the Hospital for Sick Children. Working with the hospital, we're studying the effectiveness of early detection programs for junior and senior kindergarten students, specifically looking at vision screenings and eye examinations delivered in tandem. We are conducting this pilot project in 10 communities across Ontario, screening up to 200 children in each area. Today, numerous OAO members have participated in their respective communities. The results of this pilot project will give us first-hand insight into the efficacy and cost effectiveness of this combined approach, informing our next steps. Finally, let's discuss government reform of local care. We have responded to the Patients First consultation by the Ministry of Health and Long-Term Care, which aims to shift primary care under the umbrella of local integrated health networks, better known as LINs. In turn, it could allow us to engage more fully in the delivery of eye care while promoting interprofessional collaboration. Unsurprisingly, we support these efforts to create a more equitable and integrated system built on a foundation of strong primary community care. Whether it's shepherding new legislation, developing innovative software tools, or addressing internet dispensing, the great work that OAO has accomplished is a testament to your support. But the work's not done. At the 2015 AGM, we unveiled the OAO White Paper, Optimizing Optometry's Role in Ontario, which focuses on 4 main areas. In large part because of the White Paper, we have made substantial progress and spurred ongoing conversations with government and stakeholders. In fact, we've had numerous meetings with government in the past year. The issues and recommendations that we brought forward are being heard, and we continue to have an open dialogue with government on how it can move forward with our recommendations. It's also important to recognize that we live in an era of fiscal restraint. In an effort to contain costs, government has made a number of decisions which have had a big impact on healthcare delivery. Clawbacks, capitations, and funding cuts have impacted physicians, hospitals, nurses, pharmacies, and labs. However, optometry has thankfully remained unscathed, and as such, some of the goals set forth in the White Paper will take longer to realize. Nevertheless, they remain a priority, and we still have many immediate opportunities. For instance, the chance to modernize the OHIP fee schedule with the aim of providing more clarity to our members with regards to billing. There is also the potential for a new urgent eye care fee code. As our advocacy platform, the White Paper has enabled OAO to successfully engage government on issues important to the profession. It has led to 3 promising and constructive meetings with high-level health ministry officials, the first meetings of this magnitude in more than a decade. Major inroads with both Ontario's Premier and the Minister of Health. 8 cabinet ministers attending Optometry Day events in November 2015, experiencing firsthand the important work our members are doing at the community level. Speaking of Optometry Day, this was a particularly strong grassroots initiative. It allowed members to build a relationship with their local member provincial parliament by hosting their MPP in their practice. It led to 34 important and engaging meetings that took place across the province, and plans are already in the works for this November's event. All in all, it has been an active year for OAO and optometry in general. In the fall, your board laid out a 3-year strategic plan to serve as our roadmap. The plan encompasses more meetings with government in the near future to continue our constructive conversations about optimizing the role of optometry, a commitment to support our college to advance our scope of practice, supporting our members' ongoing professional development by delivering top quality education through multiple channels, continuing our strong commitment to children's vision, specifically the I See, I Learn program. OAO has put forward a request to government for an additional 5-year extension past June 30th, 2016. Regardless of government funding, your board has committed to seeing the I See, I Learn program continue. Also, we look to new ways to collaborate with other healthcare providers. For example, preceptorships with family medicine residents to build ongoing relationships with university medical schools, examining the feasibility of leveraging telemedicine, and exploring ways to integrate optometry into Ontario's diabetes programs. We also continue to focus our efforts on advocating for the modernization of OHIP fee codes, advancing public, government, and stakeholder education, and lobbying to bring public funding for comprehensive eye exams in line with true costs. On a personal note, April 8th was my second and last AGM as your OAO president. My term ends at the end of October this year. It has been a true honor to be able to serve as your president, and I thank you for the opportunity to do so. Just let me finish by saying there is no better time to be an optometrist in Ontario. We are fortunate to have chosen such a wonderful profession. Yes, there are challenges, but what industry or sector isn't facing significant challenges or even disruption? Nobody is immune to that. But on the flip side of that disruption is tremendous opportunity. I encourage all of you to stay engaged, and together we can capitalize on the opportunities at hand. Thanks for watching.